Welcome to our channel. Today, we're discussing a crucial topic in health and safety: chemical burns. Chemical burns can occur when you come into contact with a harmful substance, and they can range in severity from mild irritation to deep tissue damage. Understanding how chemical burns happen, how to identify them, and what to do if you or someone else experiences one is essential for everyone. Chemical burns can result from various substances, including acids, alkalis, and certain chemicals like bleach or ammonia. The severity of a burn depends not only on the substance but also on the duration of exposure, the concentration of the chemical, and the area of skin affected. Signs of a chemical burn can include redness, swelling, blistering, and, in severe cases, charring of the skin. It's important to remember that some chemical burns might not be immediately apparent. Symptoms can take time to develop, so it's crucial to be vigilant if you suspect a chemical exposure. If you or someone else gets a chemical burn, the first step is to remove the source of the chemical. This might mean moving away from the area where the chemical is present. Secondly, it's vital to flush the affected area with water rapidly and generously. Rinse under running water for at least 20 minutes. For chemical burns from alkalis like lye or ammonia, flushing the area is particularly crucial as these substances can continue to cause damage even when removed from the skin. If the chemical was in a solid form, such as a powder, carefully brush off any residues before rinsing with water. After flushing the burn, if clothing is contaminated, carefully remove it. However, do not try to remove clothing that is stuck to the skin. After rinsing, pat the area dry with a clean cloth and cover it with a sterile dressing or a clean, non-stick bandage. Don't apply ice or ice water, as this can make the damage worse. It's also important to avoid using creams, ointments, or other home remedies on chemical burns unless instructed by a healthcare professional. If the burn appears severe, shows signs of infection, or does not improve after initial first aid, seek medical attention immediately. This is especially true for burns affecting the face, hands, feet, genitals, or large areas of the body. Prevention is key when it comes to chemical burns. It's critical to handle all chemicals with caution. Always read labels and material safety datasheets, or MSDS, for safe usage instructions. Use appropriate personal protective equipment, such as gloves, goggles, and masks when working with hazardous substances. Store chemicals safely away from children and ensure you have adequate ventilation when using strong substances. If you work in an environment with a risk for chemical exposure, such as laboratories or industrial settings, make sure that safety training is a priority. Know where to find the nearest eye wash or safety shower station and understand how to use them. Familiarize yourself with your workplace's emergency procedures, including how to report an incident and who to contact for medical help. In conclusion, chemical burns can be serious injuries, but understanding how they occur, recognizing their symptoms, and knowing how to respond can minimize harm. Always take safety seriously when dealing with chemicals, and don't hesitate to seek help when needed. We hope you found this information helpful. If you have any questions or suggestions for future topics, please leave a comment below. And don't forget to like and subscribe for more educational content. Stay safe, and thank you for watching.